So today we're going to talk about Chapter 6, which is planning interventions in the nursing process. And it's actually only 7 slides, so it's very brief, but there's important information that you need to know. So the purpose of nursing interventions are to achieve the patient or client outcomes. So we just talked about, planning goal and outcome statements or writing them and making those plans. These are the interventions that are going to help you to achieve those goals or outcomes that you're shooting for. They're also known as nursing outcomes. So nursing, it sounds a little confusing. Nursing outcomes are actually nursing interventions because you're giving an intervention to have an outcome specifically for you as a nurse. Okay. Measures, strategies, and activities are other names for it. And then nursing interventions are based on clinical judgment and nursing knowledge, and they also reflect direct and indirect care. And so direct care interventions are performed through interaction with the patient, such as physical care, emotional support, and patient teaching. Those are all direct care interventions. You guys need to know those. And then indirect care interventions are performed away from the patient, but on behalf of the patient or a group of patients, okay? And it may include advocacy, managing the environment, consulting with other members of the healthcare team, and making referrals. So understand the difference between direct and indirect care interventions, okay? When choosing a nursing intervention, you need to use professional standards. So just briefly with Betty's business, we're just checking in. The nurse has identified the nursing diagnosis, risk for aspiration for her client with a swallowing disorder. In deciding which feeding technique will prevent aspiration, the nurse should A. Ask the NAP who has 20 years of experience, B. Perform an internet search on the topic, C. Ask the physician to write an order with specific instructions, or D. Search for evidence-based clinical practice guidelines. And think about, too, this is all nursing interventions, okay? And the answer is D, search for evidence-based clinical practice guidelines. And the rationale behind this is that nursing interventions should be based on the most current clinical evidence that is based on science and research. So when talking about generating and selecting, and this is our last slide, so I told you it was very brief for nursing interventions. So this is talking about NIC. So you had NOC for outcomes, you have NIC for interventions. And again, this is standardized classification for specifically nursing interventions. And it consists of a label, a definition, and a list of specific activities. So the label usually consists of 2 or 3 words and some type of standardized terminology. And the definition explains the meaning of a label. And then you have your list of specific activities based on those. So it's a lot like a nursing diagnosis and intervention. It's linked to NANDA and NOC all together. If you look in that nursing care plan book, I tell you, it is a wonderful, wonderful resource for you to use. Also, I encourage you to look over tables and charts in Chapter 6. Just looking at, if you're looking at a NIC, it gives a great example of a NIC intervention, box 6-2, page 114 in your book. So this is a NIC intervention for bathing. So bathing is the label, okay? Your definition is cleaning of the body for the purposes of relaxation, cleanliness, and healing. And then you have your activities, a list of activities. Okay, so assist with chair, shower, tub bath, bedside bath, standing shower, or sitz bath as appropriate or desired. A whole list of activities specifically for bathing. So if your goal or outcome is specific to a nursing diagnosis, considering with bathing or something has to do with bathing, or your goal or outcome is for bathing specifically, you would look up your NIC intervention, which is bathing, and it gives you the definition of what it is, and activities. So those activities give you an idea of what nursing interventions you need to do based on that situation. Okay, and I'm going to, in just a little bit, do a video of the care plan, not the care plan, my apologies, the concept plan that we did in class last week and add on based on our goals and outcomes we talked about and our interventions. And let me know if you have any questions.